Welcome back to The Line. The Taos News reported recently that the Tri-County Community Services, a behavioral and mental health healthcare organization that serves Taos, Colfax, and Union counties, would close by the end of August. That means more than 22,000 adults and roughly 250 minors rely on services from Tri-County. And Sophie, it's usually a 3-month process to get another provider in, and we have a situation here where the staff had a week's notice, and we've got things closing down in 30 some plus days. You would have thought our state government would have been on top of this, that we could have come to some kind of resolution here before this situation.
Ideally, there's some crossover between the old, the leaving provider and the new provider.
Right.
What we're hearing is that new management came into the organization about 2 years ago and identified significant financial problems, financial control problems, billing that hadn't happened, et cetera. And took about 2 years to figure out this is not fixable.
Right.
Should they have known 3 or 4 months ago? I think so.
Right.
I think so. So, I mean, there is some question in my mind as to whether the director and staff knew about, which is a terrible thing to say, but knew about the need for that transition period, whether that was communicated to them or they had experience, he had experience with that. But the upshot is we have this large population up in that area who are expected to have a fair amount of shifting, of readjustment.
That's right.
Now, Presbyterian has said that they're going to help with making that transition smoother if possible, but it looks like it's going to be quite rocky, and in particular for a population that doesn't need that kind of disruption.
Good point there. Jeffrey, over all of this, of course, is our behavioral health issues statewide that we suffered with about 3 years ago. And it just feels awfully familiar. But Bernard Lujan has weighed in. He's asking the governor to have something in place by September 1st. And it seems like forces, like Sophie mentioned, are coming to bear here that try to resolve this. But in your opinion, what happened here? I mean, a lot of folks got hung out to dry here with no notice on something that should have been noted quite easily
Clearly there was operational incompetence
Yeah.
of some kind by their own admission. They weren't submitting budgets and all of that.
Right.
But on the other hand, if they're not maximizing profits, there's another reason why that company is going to close down. And I know this is going to be somewhat controversial, but I know you have 50,000 people that have lost confidence in government and this particular company. But why should, and this is possibly a rhetorical question, why should a free enterprise go into a sparsely populated rural area if they can't maximize profits? I think that's the larger question. Apparently there's another company that will do that, but what happens when that new company that comes in 6 months, a year from now, doesn't maximize profits? They're out of there too. So then what are we supposed to do? Are we supposed to create some kind of government state agency to handle this issue?
Right.
I don't know the answer.
Is it private entity the answer?
I don't know.
And often these organizations, and I can't speak to the one that's closing down, but often they are nonprofit.
Right.
And that allows them to sort of skirt the issue of and
But
obviously
even nonprofits
being a nonprofit, you still have to break even.
Nonprofits
I understand.
still operate on a zero-based budget. They still have
However,
budgets to.
I'm not sure that maximizing profit is always the best solution in these
It's
circumstances.
always about maximizing profits.
What do you think about that, Adrian?
Yeah,
There's a mission here when we're talking about behavioral health issues. There's a mission for people. It's not, due respect to Jeffrey here, it's not about your balance sheet at the end of the month, whether you're making money or not in the executive director's pocket. It's about people getting served.
I think you may have stumbled on one of the answers. Frankly, it makes me angry that there are all of these people that at the end of August, 2,500 people, 2,200 people that are going to go without their coverage. The lack of basic services is a main driver behind poverty, and poverty is a main driver behind many of the issues that we have here in New Mexico. This is history repeating itself. It's just like when Susana Martinez falsely forced the closure of about 15 behavioral health agencies. From my position, and I think many people agree, that her legacy is going to be that day in 2013 when 30,000 people in New Mexico went without their coverage, without their medication, without their providers. And that's directly related to the crime issues that we're facing.
Is this part of a bigger problem that we did not get after this situation aggressively enough when that all came to light? If you think about it, it was quite a number of months ago that this blew up on us. And it's been fairly quiet since then. We've not heard about some vigor behind it to get this back up to speed.
Well, and to the point of is a private enterprise going to go into this community? That was the goal of the closure of these 15 behavioral health agencies. The governor ushered in a situation where she tried to privatize the behavioral health system in New Mexico. 4 Arizona companies came into New Mexico. I believe all of those have closed. And so there is a role for the state government here, and there's a role for the next governor to really step forward and to use the issue of behavioral health to tackle some of these other issues like poverty and crime and inequality.
Right. Dan, a little bit of a swing here, but same subject here in Albuquerque. We've got the now proposed tiny home village project that Sarah Gustavus was in the seat here last week talking about with the panel last week. It's been approved, $2 million. City Council voted 6-3 to approve. Down on 3rd Street. And it's interesting, the controversy. I'm interested in your sense of it. Is this the answer for homeless here in Albuquerque?
So, listen, I mean, that's a big switch from the Taos behavioral health thing, Gene, but I'm with you. They, I'm not sure what the answer is.
HopeWorks Village, I should say.
I'm not sure
right.
what the answer is for the homeless population in Albuquerque. I mean, we've talked about this ad nauseum. I've traveled with work, and we have an inordinate number of mentally disabled homeless people in Albuquerque compared to other cities I've been in. It's a problem, And at the end of the day, we've got to start finding real solutions that can sustain this. When you hear people say that Susana Martinez was trying to privatize behavioral health, well, not really. I mean, the Attorney General was with her on what she was doing. They were following a federal mandate that said if these guys weren't financially viable, which is exactly what these guys were. So she took action when others were not financially viable, and she's ridiculed for it. Right. She doesn't take action on this one that's not financially viable, and she's at the same stage. So I mean, we've got to find a way. The problem is, and yes, we can't say, health care and mental health is the same as education. Right. But it's the same conversation we're having about higher education in New Mexico right now. I mean, every town cannot have a junior college. Right. Every town can't have a 4-year university. You look at, states like Arizona with a much greater population, they got 3 main universities, U of A, Arizona State, and NAU. We got Western, Eastern, Highlands, UNM, New Mexico State.
I hear you on that, but on the homeless issue,
it's the same with the behavioral health issue. Right. It's the same with, it's a shame that folks aren't going to be getting services, but you got to find a way to make it profitable for anybody to go in there, because at the end of the day, as you and I always argue at this table, there's only so many dollars. And if we're going to have all-day kindergarten and full pre-K and all this other stuff, there's only so much money. Homeless in New Mexico, there's a great opportunity. And it's amazing. I've done it multiple times at this table, Gene. I think Mayor Keller is doing a good job on a lot of fronts. I think his desire to work with the homeless population and following that program they're doing in Texas and Seattle, where they're giving the homeless people a job and helping them get into housing, which I think this tiny housing project is part of it.
Yeah, that's part of that, right?
And it gives them an address, which the biggest problem is not getting homeless people to work.
We're down to a minute. I got to get Sophie in here. Sorry about that. 42 units. You know what I mean? This has been going on around the country in different places. Your sense of it and its viability. A lot of opposition out there during those hearings.
It's a project that I really like. I think one of the challenges that they face, and this is any project like this faces these challenges, is that people want good neighbors. And there is a fear with a project like this that what they're getting is not going to be a good neighbor. And I think that's an unfortunate fear, but it is an expected fear. We know that that's how people feel.
$9 million total to pull this off. Good use of money, in your view?
Once again, I don't know what the execution is going to look like. And keep in mind, housing is only just one component in a very complicated issue called homelessness. Right. It's called sustainability. Do these folks, how do they sustain themselves after the fact? But to me, it's a classic example of, I want to help the homeless, I want to help the mentally inferred, but not in my neighborhood.
Is it worth trying? Got about 20 seconds. Just the effort. Is it worth it to you?
I think it's worth trying. Yeah. And I do have to say that 13 of those behavioral health agencies were exonerated by the Attorney General. So it's a point that can't.
Have to end that one there. When the line comes back, we'll look at local reactions to new revelations of abuse in the Catholic Church.